Welcome to our comprehensive guide on compliance audits in healthcare. In this video, we'll explore what a compliance audit is, why it's essential in the healthcare industry, and how it helps organizations maintain high standards. Compliance audits are systematic reviews that ensure healthcare providers follow laws, regulations, and internal policies. These audits protect patients, improve care quality, and reduce legal risks. Let's begin by understanding the basics of compliance audits and their significance in today's healthcare environment. Compliance in healthcare isn't just about following rules, it's about ensuring patient safety, protecting sensitive information, and maintaining trust. Regulatory bodies set strict standards to prevent fraud, abuse, and errors. Noncompliance can lead to hefty fines, legal action, and reputational damage. That's why regular audits are crucial. They help organizations identify gaps, correct issues, and demonstrate their commitment to ethical practices. Next, let's look at the key regulations that shape compliance audits. Healthcare compliance audits are guided by several important regulations. These include HIPAA for patient privacy, the Affordable Care Act for coverage standards, and the False Claims Act to prevent fraud. Each regulation sets specific requirements that healthcare organizations must follow. Auditors check for adherence to these laws, ensuring that patient data is secure and billing practices are accurate. Understanding these regulations is the foundation of a successful compliance audit. There are several types of compliance audits in healthcare. Internal audits are conducted by the organization itself to proactively identify and fix issues. External audits are performed by third-party agencies or government bodies to ensure unbiased assessments. Both types play a vital role in maintaining compliance and improving processes. Let's explore how these audits are planned and executed within healthcare organizations. Planning is the first step in a successful compliance audit. It involves defining the audit scope, setting objectives, and identifying key areas of risk. Healthcare organizations gather relevant documents, assign responsibilities, and develop a timeline. Effective planning ensures that the audit is thorough and efficient, covering all critical aspects of compliance. Next, we'll discuss the importance of assembling the right audit team. Successful compliance audit relies on a skilled and diverse audit team. This team typically includes compliance officers, healthcare professionals, legal experts, and IT specialists. Each member brings unique expertise to the table, ensuring a comprehensive review. Collaboration and clear communication are key to identifying issues and implementing solutions. Now, let's move on to the audit tools and resources that support the team's efforts. Audit teams use a variety of tools to streamline the compliance audit process. These include checklists, data analytics software, and secure document management systems. Technology helps auditors track compliance metrics, analyze trends, and generate reports efficiently. By leveraging the right tools, healthcare organizations can ensure accuracy and save valuable time during audits. Let's see how the audit process unfolds step by step. Pre-audit preparation is all about getting ready for the main event. This stage involves reviewing previous audit findings, updating policies, and ensuring all necessary documents are available. The audit team communicates with staff to explain the process and address any concerns. Good preparation sets the stage for a smooth and effective audit, minimizing disruptions to daily operations. Next, we'll look at how the audit is conducted on-site. During the on-site audit, auditors observe operations, interview staff, and review records. They assess compliance with regulations and internal policies by examining real-world practices. Auditors may visit different departments, check documentation, and test processes. This hands-on approach helps identify strengths and areas for improvement. After gathering evidence, the team prepares to analyze their findings in detail. Once the on-site activities are complete, auditors analyze the collected data. They look for patterns, inconsistencies, and potential compliance risks. Data analysis helps auditors understand the root causes of issues and prioritize corrective actions. By using analytics tools, the team can generate detailed reports that highlight key findings and recommendations. Let's see how these findings are communicated to healthcare leadership. Reporting is a critical part of the compliance audit process. Auditors compile their findings into a clear, concise report for healthcare leadership. The report outlines areas of compliance, highlights deficiencies, and recommends corrective actions. Effective reporting ensures that decision-makers understand the audit's outcomes and can take appropriate steps to address any issues. Next, we'll discuss how organizations implement these recommendations. After receiving the audit report, healthcare organizations must act on the recommendations. This involves developing action plans, assigning responsibilities, and setting deadlines for improvement. Continuous monitoring ensures that corrective actions are effective and sustainable. By addressing audit findings promptly, organizations can strengthen compliance and reduce future risks. Now, let's explore the common challenges faced during compliance audits. Compliance audits in healthcare come with their own set of challenges. These may include limited resources, complex regulations, and resistance to change. Staff may feel overwhelmed by audit requirements or fear negative consequences. Effective communication, training, and leadership support are essential to overcoming these obstacles. Let's look at strategies for building a culture of compliance within healthcare organizations. Strong culture of compliance starts at the top. Leadership must set the tone by prioritizing ethical behavior and supporting compliance initiatives. Regular training, open communication, and recognition of good practices encourage staff to embrace compliance as part of their daily work. When everyone understands the importance of following rules, audits become smoother and more effective. Next, let's discuss the role of ongoing education in compliance. Continuous education is vital for maintaining compliance in healthcare. Regulations and best practices evolve, so staff must stay informed through regular training sessions and updates. Education programs can include workshops, online courses, and scenario-based learning. By investing in ongoing education, organizations empower their teams to recognize and address compliance issues proactively. Now, let's examine the importance of documentation in the audit process. Accurate and thorough documentation is the backbone of compliance audits. Every policy, procedure, and action must be clearly recorded and easily accessible. Good documentation provides evidence of compliance and supports audit findings. It also helps organizations track progress and demonstrate accountability. Next, we'll discuss how technology can enhance documentation and streamline the audit process. Technology plays a crucial role in modern compliance audits. Electronic health records, audit management software, and secure cloud storage make it easier to organize and access information. Automation reduces manual errors and saves time. By embracing digital tools, healthcare organizations can improve efficiency, accuracy, and security throughout the audit process. Let's look at how data privacy is protected during audits. Protecting patient data is a top priority during compliance audits. Auditors must follow strict protocols to safeguard sensitive information. This includes using encrypted devices, limiting access to records, and following HIPAA guidelines. Data privacy not only protects patients but also builds trust with the community. Next, we'll explore the role of risk assessments in compliance audits. Risk assessments are a key component of compliance audits. Auditors identify potential risks to patient safety, data security, and regulatory compliance. By evaluating these risks, organizations can prioritize their efforts and allocate resources effectively. Regular risk assessments help prevent problems before they occur and ensure continuous improvement. Now, let's discuss how audits contribute to quality improvement in healthcare. Compliance audits are not just about finding faults, they're powerful tools for quality improvement. By identifying gaps and recommending solutions, audits help healthcare organizations enhance patient care, streamline processes, and reduce errors. Continuous quality improvement leads to better outcomes for patients and greater organizational success. Next, we'll look at the role of feedback in the audit process. Feedback is essential for a successful compliance audit. Auditors provide constructive feedback to staff, highlighting strengths and suggesting areas for improvement. Open communication encourages a positive response to audit findings and motivates teams to take corrective action. Feedback also helps organizations refine their policies and procedures for future audits. Now, let's discuss the importance of follow-up audits. Follow-up audits are conducted to ensure that corrective actions have been implemented and are effective. These audits help organizations track progress, address lingering issues, and maintain compliance over time. Regular follow-ups reinforce a culture of accountability and continuous improvement. Next, we'll explore the role of external agencies in healthcare compliance audits. External agencies play a significant role in healthcare compliance audits. These organizations, such as government bodies and accreditation agencies, provide independent assessments of compliance. Their objective perspective helps identify issues that may be overlooked internally. External audits also enhance credibility and demonstrate a commitment to high standards. Now, let's look at the benefits of regular compliance audits. Regular compliance audits offer numerous benefits to healthcare organizations. They help maintain regulatory compliance, improve patient safety, and reduce the risk of legal issues. Audits also promote transparency, accountability, and continuous improvement. By making audits a routine part of operations, organizations can build trust with patients and stakeholders. Next, we'll discuss how to prepare for a successful audit. Preparation is key to a successful compliance audit. Organizations should review policies, update documentation, and train staff on audit procedures. Clear communication and a positive attitude help reduce stress and ensure cooperation. By preparing thoroughly, healthcare providers can demonstrate their commitment to compliance and make the audit process smoother. Now, let's look at the role of leadership in supporting compliance. Leadership plays a pivotal role in fostering a culture of compliance. By setting clear expectations, providing resources, and leading by example, leaders inspire staff to prioritize compliance. Their support ensures that compliance initiatives receive the attention and funding they need. Strong leadership also helps resolve challenges and maintain momentum throughout the audit process. Next, we'll explore the importance of communication during audits. Clear and open communication is essential during compliance audits. Staff should be informed about audit objectives, procedures, and expectations. Regular updates and feedback sessions keep everyone engaged and reduce anxiety. Effective communication also helps resolve misunderstandings and ensures that corrective actions are implemented promptly. Now, let's discuss the role of training in audit readiness. Training is a cornerstone of audit readiness. Staff should receive regular training on compliance requirements, audit procedures, and best practices. Scenario-based exercises and role-playing can help staff understand their responsibilities and respond confidently during audits. Well-trained teams are more likely to succeed in audits and maintain ongoing compliance. Next, let's look at the importance of continuous improvement. Continuous improvement is at the heart of effective compliance audits. Organizations should regularly review their policies, procedures, and outcomes to identify areas for enhancement. By fostering a mindset of learning and growth, healthcare providers can adapt to changing regulations and deliver better care. Continuous improvement also helps organizations stay ahead of potential compliance risks. Now, let's discuss the impact of audits on patient care. Compliance audits have a direct impact on patient care. By ensuring that policies and procedures are followed, audits help maintain high standards of safety and quality. Patients benefit from reduced errors, better communication, and improved outcomes. Audits also reinforce the organization's commitment to ethical and patient-centered care. Next, we'll explore how audits support organizational reputation. Strong compliance program supported by regular audits enhances an organization's reputation. Patients, partners, and regulators are more likely to trust healthcare providers that demonstrate transparency and accountability. A positive reputation attracts new patients, retains staff, and opens doors to new opportunities. Now, let's look at the legal implications of compliance audits. Compliance audits help healthcare organizations avoid legal trouble. By identifying and correcting issues early, audits reduce the risk of fines, lawsuits, and regulatory penalties. Legal compliance also protects the organization's license to operate and ensures continued access to funding. Understanding the legal landscape is essential for effective audit planning and execution. Next, let's discuss the financial benefits of compliance audits. Compliance audits can lead to significant financial benefits. By preventing fraud, reducing errors, and improving efficiency, audits help organizations save money. They also protect against costly penalties and support access to reimbursement programs. Financial stability allows healthcare providers to invest in better facilities, technology, and staff development. Now, let's explore the role of ethics in compliance audits. Ethics are at the core of compliance audits. Auditors must act with integrity, objectivity, and confidentiality. Ethical audits build trust and ensure that findings are accurate and unbiased. Organizations should promote ethical behavior at all levels, from leadership to frontline staff. Next, we'll discuss how to handle conflicts of interest during audits. Conflicts of interest can undermine the integrity of compliance audits. Organizations should establish clear policies to identify and manage potential conflicts. Auditors must disclose any relationships or interests that could influence their judgment. Transparent processes help maintain trust and ensure that audit findings are credible. Now, let's look at the importance of confidentiality in audits. Confidentiality is essential during compliance audits. Auditors handle sensitive information, including patient records and internal documents. Strict protocols must be followed to prevent unauthorized access or disclosure. Confidentiality protects patients, staff, and the organization's reputation. Next, we'll discuss the importance of transparency in the audit process. Transparency builds trust in the audit process. Organizations should communicate openly about audit objectives, procedures, and findings. Transparent audits encourage staff participation and foster a sense of shared responsibility. When everyone understands the process, audits are more effective and less stressful. Now, let's explore the future of compliance audits in healthcare. Future of compliance audits in healthcare is shaped by technology and evolving regulations. Artificial intelligence, data analytics, and automation are making audits faster and more accurate. Regulations are becoming more complex, requiring organizations to stay agile and proactive. By embracing innovation, healthcare providers can enhance compliance and deliver better patient care. Next, let's discuss the importance of adaptability in compliance. Adaptability is crucial for success in compliance audits. Healthcare organizations must be ready to adjust their policies and procedures as regulations change. Flexible teams and ongoing training help organizations respond quickly to new challenges. Adaptability ensures that compliance remains a priority, even in a rapidly changing environment. Now, let's look at the global perspective on healthcare compliance audits. Compliance audits are a global concern. Different countries have unique regulations, but the core principles of patient safety, data protection, and ethical behavior are universal. International standards such as ISO certifications help organizations align with best practices worldwide. Learning from global experiences can strengthen local compliance efforts. Next, we'll discuss the importance of collaboration in compliance audits. Collaboration is key to successful compliance audits. Healthcare providers, auditors, regulators, and patients must work together to achieve common goals. Open dialogue, shared resources, and mutual respect foster a positive audit environment. Collaboration also helps organizations learn from each other and implement best practices. Now, let's look at the role of patient involvement in compliance. Patients play an important role in healthcare compliance. Their feedback and experiences provide valuable insights into the effectiveness of policies and procedures. Engaging patients in the audit process helps organizations identify areas for improvement and build trust. Patient-centered audits ensure that care remains safe, ethical, and responsive to community needs. Next, we'll discuss the importance of celebrating audit successes. Recognizing and celebrating audit successes boosts morale and reinforces a culture of compliance. Organizations should acknowledge the hard work of staff and share positive outcomes with the entire team. Celebrations can include awards, public recognition, or team events. Celebrating success motivates everyone to maintain high standards and strive for continuous improvement. Now, let's summarize the key takeaways from this video. Summary: compliance audits are essential for maintaining high standards in healthcare. They protect patients, ensure legal and ethical compliance, and drive continuous improvement. Success depends on strong leadership, effective communication, ongoing training, and a culture of collaboration. By embracing audits as opportunities for growth, healthcare organizations can deliver better care and build lasting trust with their communities. Thank you for joining us on this journey through compliance audits in healthcare. By understanding the audit process and its benefits, organizations can create safer, more effective, and more ethical healthcare environments. Remember, compliance is an ongoing commitment that requires teamwork, adaptability, and a dedication to excellence. Stay informed, stay compliant, and continue striving for the highest standards in healthcare.